Hey everyone, welcome to Holistic Lifestyle Tips, Getting Real About the Woo-Woo. I'm Becky Russell. I'm owner of a wellness company, Hope Essential, and I educate about essential oils and also about holistic living. And I've been doing this over 25 years. And what I hope to accomplish here is instead of saving holistic options for the last resort, that you think of them first. And it served me well, and I just want to share what I've learned. So, this is week 7, can't believe it already. And last week we talked about sleep, the importance of sleep. And honestly, I could talk, you know, for a month on it or longer about how important sleep is. And I just wish there was more education about it. So maybe there'll be a future little series on sleep. So be looking for that. Anyway, the thing that we need to understand, though, is maybe if the reason we can't sleep is pain. And if you have a chronic pain issue, sometimes that first resort is over-the-counter meds. And then when those don't work anymore, then it's the prescription meds. And then we're getting into some heavy stuff that could lead to an addiction or severe damage to organs and so forth. But what a lot of people don't understand is even Aleve or, Advil, if you take those on a daily basis for years on end, you can still have some pretty bad side effects. I'm not saying for sure that you will, but that possibility is there. And some of the most common things are it bothers your stomach lining. And then some of the more serious things is it can raise your blood pressure and cause kidney problems and even symptoms of heart failure. So that is over-the-counter meds. So you get into the heavy-duty painkillers, and that's going to be even more serious possibly. So if you can look at some other modalities, it might be helpful to not go that route. So the two things I want to talk about tonight, I have done both, are acupuncture and cupping therapy. Now, acupuncture, you've probably heard about. It's much more common now, but over 25 years ago when I was exploring all this, it was just sort of, the awareness was just starting to raise a little bit. And I don't think it's a coincidence that Dr. Iva, the doctor of Oriental medicine, every treatment she did always included acupuncture. And so if you're not sure about what that entails, first of all, I want to tell you a secret that maybe some people don't know or don't really put much weight on this advice. If you do decide to try acupuncture, then drink a lot of water before you go. And it may sound silly, but the same thing holds true with when you're getting your blood drawn for labs. Drink a lot of water before you go, and that helps with the circulation. So even though the needles for the acupuncture are super, super tiny, thin, it still helps because a lot of times you're so sensitive. I know when I had the fibromyalgia, just brushing my skin, it hurt. So I was super sensitive to anything. And so drinking more water helped before the acupuncture. So basically, acupuncture is a traditional Chinese medicine practice, originated thousands of years ago, and it's based on the premise that a blockage or disturbance in the flow of the body's life energy can cause health issues. And according to a theory, there are 1,000 acupuncture points on the body, each lying on an invisible energy channel or meridian. So if you do go to an acupuncturist, they'll have those charts with the meridians. It's really fascinating. Um, I'm not going to go into how it all works and all that because I keep these segments really short. But you can Google it, of course, but talk to someone too that has tried it. I know when my son had his first treatment for some knee pain, he actually fell asleep because they have you lay there for like 20, 25 minutes after the needles are in, and he fell asleep. Now, with my racing brain, I can't do that, but it really relaxes you. So some of the things that people go to an acupuncture for are anxiety, arthritis, and chronic pain, depression, insomnia, migraines, sciatica, sinus congestion, stress and anxiety, and a lot more. But those are some of the real common things. And I would just really encourage you to not save it as a last resort. And then the other modality is a cupping. And I've had it several different types done. And I even do it on myself. They have little home kits. Of course, it's not going to be as effective, probably, but it does help with in between visits. And it's really interesting. The first time I became aware of it was with Michael Phelps, because when you saw the Olympic coverage, he had all these round red spots, circles on across his back and shoulders, and he had the cupping therapy done before the meet, and that sort of raised the awareness about that. And so it is also an ancient form of alternative medicine, and they put special cups on your skin for a few minutes to create suction, and it helps with pain, inflammation, blood flow, helps you relax, and it's sort of a type of deep tissue massage. And the reason it's been so helpful for me is with the chronic neck and shoulder stiffness, if they don't do something first to loosen it up, they wear themselves out trying to get that stiffness to ease up. So the cupping, if you do that first, they usually do a really sort of quick, deep tissue thing to get things going. And then they'll do the cupping. And then with that suction, once those cups are removed, it has relaxed those muscles. And then they can do the easier deep tissue massage or myofascial release or whatever it is I'm there for. So it has been very effective for me. And one type is a little more intense, so you need to talk to your acupuncturist or whoever, massage therapist, about what your choices are. But don't do it yourself first and think that is a real test. You should have a professional do it, and you will actually then get the best benefits. It's just like anything. There is some pressure when those cups are put on there, but it's not so painful that you're, in that much discomfort. At least it wasn't for me. And again, there's several different kinds of cups and different therapies. I'm not going to go into that here. You can do the research. A lot of acupuncturists also do the cupping, but not all. And some massage therapists are trained to do that. So I would love to hear what your takeaway is from this tonight. Have you heard, I know you've probably heard of acupuncture, but have you heard of cupping therapy? And are you on a daily or monthly or some kind of regular dose of a pain reliever? And will you read that insert to see what all those possible side effects are, and maybe think about something alternative and before it gets so bad? So I would love to hear your takeaway from tonight, and just put it in the comments what you think. And if you're willing to try it, I would love to hear it. So till next time. Choose you, choose natural, choose now.